Have you ever left a doctor's appointment and then later thought about all of the questions you should have asked? Or looked at test results and thought, I have no idea what this really means? Hi, I'm Ife Grady, and this is Ageless AI Collective. Managing your health as you're getting older is already overwhelming. It's a lot. Tracking symptoms, preparing for doctor's visits, trying to understand what your body is telling you. What if AI can help relieve some of that load? Today, I have 3 AI tools that can help you track, plan, and advocate for your health. Let's get into it. My first search is on ChatGPT, and this is a medication check. Before we get started, let me explain this is a fictional for demonstration purposes only. And let me tell you the prompt. I take the following medications daily: lisinopril, metformin, atorvastatin, omeprazole, and low-dose aspirin. Can you tell me what each one is for and flag anything I should be aware of when taking them? Great. So it's saying it's a great question. This is the kind of awareness that helps you stay in control of your health. And this is what we're talking about here, being in charge of our health. So it walks through each one of them. The lisinopril is for high blood pressure. The metformin is for type 2 diabetes, often first line treatment for diabetes. High cholesterol, atorvastatin, and omeprazole is for acid reflux, and a low dose aspirin. So, what to be aware of? This is a very common combination, but there are a few things to keep an eye on. This is what we're going to look at. Aspirin can irritate your stomach and increase bleeding risks. Omeprazole is often described to protect your stomach from that. This combo is actually intentional. Kidney function. This is 2 of the other ones. Both involve the kidneys and how they're processed. Usually safe together. Okay? This is all very interesting and very informative, and definitely let you know what you need to be looking out for. Here it is. Timing matters. Best taken before meals on one of them. Usually taken with food. Atorvastatin often taken at night. So these are great insights for us to know specifically what we are taking and what they are for. You get just real clarity on it. And also what works well together and when to take them. Valuable information. I'm loving that. My next search is help me create a simple symptom tracker I can bring to my doctor. I want to track energy, sleep, pain, and mood. Okay, I love this idea. And it's going to give you a simple tracker so you can turn I think I've been feeling into something your doctor can actually use. So you're tracking your symptoms. Day 1, energy, exhausted. Anything unusual today? Get a weekly snapshot. This works. Why this works? You're giving your doctor trends, not just one-day complaints, context, sleep and mood together, something measurable. That makes it much easier to connect symptoms like medication effects, sleep issues, etc. You see how helpful this would be, having this to take to your doctor, because on the real side, we know that especially with the U.S. medical system, you only have a very, very limited amount of time in front of the doctor. And so being prepared with this will make things go much more smoothly, and you can advocate better for your health. This is excellent. The last search on ChatGPT will be to get an explanation of medical terms in plain language. So I'm saying, my doctor said I have moderate stenosis of the lumbar spine. Can you explain what that means in plain English? And this is a good one, what questions should I ask? So let's see ChatGPT. Okay, the lumbar spine, that's the space in your lower back where nerves travel, has narrowed, and it even has a detailed picture. And so it explains, think of this as your spinal canal like a hallway where nerves pass through. Normal, roomy. Stenosis, hallway gets tighter. Result, nerves can get compressed or irritated. And it even tells you what moderate means. Not mild and not severe, which means symptoms come and go. This is something that you need to know. What can it feel like? So you understand lower back pain, pain or heaviness in the legs, numbness or tingling. These are some questions to ask your doctor. What is being compressed? What symptoms should I expect versus what should I worry about? What are my non-surgical options? What movements help versus make it worse? You see how valuable these questions are to be prepared when you go to the doctor, when you get this diagnosis. What do I need to know about this diagnosis? How do I need to behave? Could any of my current medications affect this? That is good because interaction between medications often complicates outcomes. It's excellent. But you see what this does for you. It gives you plain language and lets you see what's happening, what might be happening to your body, and also prepares you to address the questions with your doctor. Absolutely valuable when you are advocating for your own health. Absolutely valuable. My next searches will be on Perplexity. Perplexity is like a search engine and an AI assistant combined. What makes it especially good for health topics is that it cites its sources, lets you know where the information is coming from. So I am trying to understand the diagnosis. I was recently told I have prediabetes. What does this mean? What are the risks? And what lifestyle changes have the strongest evidence? Let's see. Right here it is. It means your blood sugar are higher than normal, but not high enough to diagnose type 2. The key risks, of course, raises the risk of progressing to type 2 diabetes. And it says the studies show relative risk up to 4 to 10 times higher, depending on the definition, which increases your chance of vascular disease, etc. The strongest lifestyle changes. This is what I'd be interested in. Intensive lifestyle intervention can cut the risk by 58%. Weight loss alone, brisk walking, exercise, healthy eating, reduce calories, low fat and low sugar, physical activity also improves your insulin sensitivity. Follow up. This is the information it gives you, and it gives you ways that you can follow up on it. Also, what I want to bring your attention to is here. This is the source of the information. That's the thing that Perplexity does well. Here's the source. The source of this is the Mayo Clinic. The source of this it looks like the National Institutes of Health. So you see where it's getting the information from, also from the National Institutes of Health. And that's one of the values of Perplexity. It definitely shows you where they get the information so that you can follow up yourself if you want to. My next search on Perplexity is a pre-appointment preparation. I have an appointment with my cardiologist next week. I have high blood pressure and take lisinopril. What 8 most important questions I should ask? Okay, here are the top questions. What's my blood pressure today, and what should my target goal be? Is my current lisinopril dose still appropriate? What side effects should I watch for? Do I need blood tests to monitor kidney function? Should I monitor my blood pressure at home? These are important things that you can ask your cardiologist. It is so important to be prepared when you get there. You have such a limited amount of time. Your preparation is absolutely key. And just as before, it tells you where the information is coming from CardioSmart. High blood pressure questions answered by cardiologists. This is Women's Health. So it tells you exactly where they got the information from so that you can follow up and find out more information if you need it. Being prepared means everything. My third Perplexity search is understanding a test. My recent blood work showed my A1C is 6.1. What does that number mean? What should I do next? Okay, it says an A1C of 6.1 indicates pre-diabetes. Your next steps: focus on intensive lifestyle changes first. Lose weight if you need to, if you're overweight, 150 plus minutes of moderate exercise, and a diet low in refined carbs. Monitoring care. So it tells you to retest A1C in 3 to 6 months, and says discuss with your doctor, especially tying into your blood pressure management and upcoming cardiologist visit. Quit smoking if applicable, and manage stress, sleep for better results. Once again, it's telling you where it comes from: Cleveland Clinic in this case, Dr. Oracle, and a diabetes journal. Excellent to know exactly where the information is coming from so that you can follow up. Now, my next demonstration is one that surprised me. This is with NotebookLM. And you might remember I used NotebookLM to create the podcast a couple of weeks back. That's because NotebookLM takes your information that you upload and then summarize it and gives you answers based on questions you ask about your own information. And so for this, in order to get started, you would go to notebooklm.google. You could create a notebook, my health records, and then you upload your health documents. I uploaded 3 documents: some lab results on 2 pages, and then the results of a bone density scan and a muscle scan that I had. And so I'm asking, explain these results in simple terms and help me prepare 3 to 5 questions for my doctor. Okay, and it is giving me the results of my bone scan. It says my lab results and bone density report show a generally healthy profile for my age, which is 77, with a specific finding in your blood work that you should discuss with my doctor. Okay, the bone scan is normal. The body composition, the BMI, is 21.3. My kidney, in general, this is within normal range, blah, blah, blah. My muscle enzymes seem to be normal. And here are the questions for my doctor. Regarding my CKMB results, my level was 27, which is above normal range, but my CPK was normal. What could cause this specific enzyme to be elevated? And do I need follow-up heart tests like an EKG or an echocardiogram? These are questions that I could ask my doctor, and I probably will. And here's regarding bone health maintenance. Since my bone density is currently normal, what should I be doing to maintain it? Should I continue my current BEC supplements, which are things that I actually take, or do I need to add calcium? And indeed, I did ask her whether I needed to add calcium, and she said no. And it says future screenings reports suggest a follow-up bone scan in a couple of years. Regarding my kidney health, my creatinine and microalbumin were normal. And does this mean my kidney health is stable? And are there any dietary changes you might recommend? In any case, this is telling me exactly what my scans mean. My doctor already looked at this, and what questions that I could ask. And I did ask a couple of these questions before going to NotebookLM. And I'm going to do one more search. And look, I like what it says here. I am an AI, not a doctor. Lab results must always be interpreted by a qualified medical professional who understands your medical history. You should schedule an appointment to review these results in detail. This is it saying, I am not your doctor. I am AI, so you need to go on and put this to your doctor, which I love. It's not trying to be your doctor. It's just trying to bring you some clarity with some questions that you can go into your doctor with. Very helpful. My follow-up question for NotebookLM is, I have an appointment on Friday with my primary care doctor. Based on my records, what are the most important things I should discuss with her? Okay. For my upcoming appointment, the most critical topic to discuss is elevated heart enzyme found in my blood work. Ooh, the elevated CKB level is priority 1. And I saw that. I saw that it was elevated. Recognize that. And then after that, I talk about bone health maintenance. And it says my T-score, this is for my bone health, is 1.8, which is considered normal and even slightly above the limits considered normal for my age and sex. And so it says, while the results are good, the report recommends ensuring an adequate intake of calcium and vitamin D. These are things that I would ask her about. And then the tests show that your kidneys are functioning well. And I want to confirm that these results indicate stable kidney and inflammatory health. And he talks about my body composition. The body mass index is 21.3, which is squarely in the normal range. So I wanted to ask if my current fat distribution and fat levels are optimum for my age, and if there are any specific lifestyle adjustments I can make to maintain this healthy profile. And it asks some specific questions, blah, etc. And you see how prepared you can be for your next appointment based on the information you got here. And this information, I'm going to say again, is your information that I uploaded my own personal information, and it is giving me feedback based on the information I gave it. Very, very helpful. So that completes the 3 demonstrations. So there you have it. 3 AI tools, 3 different jobs. ChatGPT helps you understand and track. Perplexity helps you research and prepare. And NotebookLM uses your own health records. Together, they give you something really valuable, a way to show up prepared, informed, and ready to advocate for your own health. If you found this helpful, please like this video and subscribe to Ageless AI Collective. I post every week with tools and ideas specifically for us. And check out the comment section where I included a free guide with all of the prompts that I used in my demonstration and a symptom tracker. Thank you so much for joining me. I'll see you next week.